Well, I've found this an absolutely fabulous day, and I believe that you will go away and we will all go away and actually do what I said, which is make today a landmark in terms of the type of change we need to make. I'm very sort of realistic, and I think we're all very realistic, that we weren't going to be able to come up with every solution today to help people go away and make the difference, because actually this isn't a one-size-fits-all change programme you're all embarking on. You all need lots and lots of different tools. You need lots of different partnerships and relationships to make the differences you need to make. So I hope we have, I'm sure we have, I really do hope we have given you the insights that you need to go away and do the next steps. And I was remembering earlier what we tried to do was inspire, to share and to engage. Now my sense is we have done that, and I hope when you come round to completing your evaluations you feel we've achieved that. Some key messages I think that came out was the issues we're facing are exceedingly complex. This is more complex than most of the stuff people will experience in any acute hospital setting, any hospital environment or any other type of care setting. And I think the first thing is we must realise this is a wicked problem that will need complex solutions, and we need to get that message across to other people. It's not going to be easy and we need the help to do it. I think it's a very funny microphone. It's all about partnerships, and we've seen many of those partnerships today. And the first one I really want to push is those people working on how district nursing or community nursing and primary care nursing are working together. I want you to really push that work, and I think we need some more pilot sites where that is happening, because I think the future has to be a much more integrated model potentially, and we need to have many more case studies and examples of how that's being done. It's great to see London Ambulance here. Having spent an evening on an ambulance last March, I think we really underestimate how they need to work better in partnership and vice versa. We all need to work as one system. And I think if you haven't in your locality, start thinking about how you are working with them. The small things do really matter, because actually out in someone's home at 2 o'clock in the afternoon, when you've still got 10 people to visit, for example, if you haven't got the right access to information and you haven't got the support you need, those small things really do matter. So we've got to get the strategy right, whether that's at a national, regional or borough level, but we've also, as the examples we've heard, really got to get it right for individual nurses, and we've got to find ways of unblocking the things that stop middle managers being able to make those changes quickly. And hopefully we've got some examples of how we can do that. So hopefully you've got the techniques to go away and start doing some of the change, and also you've got some examples of actual practice to do. In terms of other examples, I think information has come across really strongly, and I think we as nurses must stop hiding from this. It's not just about numbers, it's about how it helps us do our jobs. We should not shy away from it, and we need to start really early. And we also need to, I think the next event needs to be frontline nurses with social workers. And we need to start having a debate about how we work practically to support that change. And my 5 o'clock telephone call is with the National Association of Directors of Adult Social Services, with colleagues from the other arm's length organisations, to work out how we as nurse leaders work effectively with those colleagues as well, because many of the conversations we've been having are because we haven't got that partnership really well. So that's all I think, I hope you all will go away. I want to thank everyone, from the speakers to the people who've organised it, those who are here today and who are not, because I know Chris Caldwell's on holiday, for really organising such a fabulous event. The last thing I just want to do is, on your tables, never miss a chance to share something, is some work we commissioned earlier in the year called Building and Strengthening Leadership, Leading with Compassion. And what today has been about is actually helping you to have some of the tools to do that. Get that frontline engagement, really good leadership to drive really good care. This is a great piece of research to help you think about ways of leading, both as an individual, as a team, as an organisation, to help support that journey you're on. And there's also a field guide for individuals. I'm not going to spend time going through it now. It's something you will want to read at your leisure. And there's an event on the 25th of March that's London-wide about leadership and culture to support compassion. And this will be a key part of that day. But it's a useful read for you all.